Hi, Rebecca Morehead here, and I just want to do a post about the controversy, if you will, on the Core 10 measure for meaningful use. There seems to be a lot of communication happening nowadays in email, in phone calls, and we're getting a lot of buzz here at Practice Manager Solutions about this because there seems to be either some misrepresentations, misunderstandings, or just a lack of knowledge on this as far as the measures for reporting for public health. So I want to point out a couple things to you. First of all, there are 3 options on this measure. So the Core 10 is what we're talking about. So we're talking first for testing for meaningful use for 2015 and the deadline being March 11th, okay? So that's an extension on that. The second thing I want to point out here is for Core 10, and I'm reading from the measure itself, is that there are 3 options to active engagement. So this is what you need to know. You have 3 options, okay? So option one is completed registration to submit data. So it's showing intent to submit data. All right, this option allows providers to meet the measure with the public health or the clinical data registry has limited resources to initiate the testing and validation process. So this is just an initiation, an intent to submit data, okay? Now, your option 2 is to do testing and validation. So if you have already registered with a specialized registry or a public health department and you are communicating with them, then you are testing and validating, all right? Option 3 is production, so you're in ongoing transmission with them. So you have 3 options, and there are alternates and exclusions to this measure. So if you're being told that you have to be submitting data, just know that you have 3 options, okay? Furthermore, because of everything that's been going on with this, the Centers for Medicare and Medicaid Services has just put out an EHR incentive programs FAQs on this public health reporting requirements because there are so many questions coming in, I'm sure. And so they are addressing this completely and wholly to the questions like, can a provider register their intent after the first 60 days of the reporting period? And the answer here is if a registry declares readiness at any point in the calendar year after the initial 60 days, a provider may still register their intent to report to that registry to meet the measure under active engagement option 1. So you can see here that the options are very important. And I just want you to know that active engagement means you're engaging, you're taking initiative. And so you can take this 2016 year to figure out what specialized registry you really want to report to. So I know this is a little bit longer post than we usually do, but I just wanted to cover this. I'm going to put the links here below so that you can read these for yourself in case you didn't get them or you're not on the mailing list. And I hope that this gives you some peace of mind about this. Okay? All right.